Welcome to Plus Talk on Plus Life. We're all about turning positive into a plus. We are talking about HIV treatment and staying on it and what happens if you can't stay on it. Dr. Seshadri, our resident medical expert, is here. Good to see you, Doc.
It's great to be here.
I do like you in a polka dot. I'm going to say that.
And I love you in stripes.
I'll take the compliment.
Yeah.
There's a lot going on at the moment in this country and around the world as it pertains to access to HIV care, funding of programs and all sorts of things. So I thought this would be an interesting topic to discuss because there is a chance that people here in the United States and certainly around the world may no longer have their daily access to treatment. So if someone can't access their HIV treatment or their HIV meds right now, what steps can they take to at least stay healthy while they figure out a solution to it?
Yeah. I'm going to start off by saying keep in touch with your doctor at all times, because if you are having lack of access to medications, your doctor needs to be up to date. See if they can offer any resources too. So remember to use your primary care physician or your healthcare provider first, and stay in touch. Keep in touch with your support groups too, because you never know where you can get other ideas from, right? Um, and then as far as staying healthy, I would just say the big top four, right? Making sure you get enough sleep, 7 to 9 hours of sleep, adequate hydration, healthy lifestyle, eating a well-balanced diet. And then last is exercise. So maintaining a healthy lifestyle, I would say decreasing risky behaviors. What I mean by that is not just in terms of sex, right? It's also with the measles outbreak that's going on, making sure that you stay protected when it comes to exposing yourself to other viruses and bacteria, especially around outbreaks, and also making sure to protect safe sex measures, things like that, just in general to keep yourself healthy.
Okay. So if my HIV treatment has been interrupted, how hard is it to restart it? And does it affect the virus in the body, or can I get back on track without sort of any serious health or setbacks?
Yeah. In general, Carl, I would say this depends on how long you have gone or missed your doses. For the most part, I'm going to say that if you have missed a couple of doses, not a long time, it's very easy to get back onto your regimen and stay consistent, right? And not so much of an impact on your viral load or your CD4 count, your immune system. But if you've gone through an extended period of time where you haven't been able to take your medications, yes, you can restart it, but it may take a little bit longer. So instead of days to weeks of getting back to where you were, it may take months to get back to making your viral load undetectable and that CD4 count higher and your immune system strong enough.
And so all the more reason why during that time to the answer of the first question, try and live as healthy a lifestyle as you can and certainly cut down on, behavior that may put others and yourself at risk for picking up something else.
Yes.
Okay. What about for people who have missed doses? What's the safest way to get back into a treatment routine? And ultimately, can they achieve the same viral suppression that they had before?
Yeah, they can. I'm going to answer that first. You can definitely attain the same viral suppression that you have before. Timing depends, like I said. Getting back on a treatment regimen as soon as possible is very important, number one. Let's just talk about the three things that can happen when you stop taking your medications. One is that your viral load, so the amount of virus that's in your body, can start to increase, right, and spread. Number two, what can happen is viral rebound. So the virus becomes active and activated. And that's creating.
How is that different from the amount of virus?
You can have an increase in virus, but then it has to start being active and suppressing your immune system, right? Then starting to destroy your immune system. So different,
Right.
Viral load versus viral rebound.
So rebound, we really don't want rebound.
We don't want rebound.
We don't want any of this, but we especially don't want rebound.
And then third, what we see, and more often when you've stopped your medications for an extended period of time, is the risk of drug resistance. So if you potentially get back on the same medication that you were on before after not have taken it for months, it may not be as effective. So I would say the third is also very important.
The good news is that in this day and age, thank God, we have various treatment options.
Absolutely.
So if one does stop working, we've talked about this before, if one treatment does stop working, there are other options. It's not the end of the line for you. If someone's been off their meds for a while, is it really still possible to recover and get HIV back under control and on the right treatment?
Absolutely. Like I said, it's just a matter of how quickly. So restart it as soon as possible. Number two, your doctor may recommend, if you've been off of it for a while, getting extra additional blood tests just to monitor and keep track of your CD4 count and your viral load to make sure that we're heading in the right direction. If you needed to change up your drug regimen, we need to make sure that it's working, right? If you're on a different drug regimen because you stopped, potentially leading to drug resistance, factors like that. So I'm gonna say, don't worry, restart, become consistent, hold yourself accountable. If you need to talk to people around you to hold yourself accountable, do whatever it takes to keep yourself consistent.
And stay in touch with your medical professional.
Yes, please.
I mean, I always like that. We stay in touch too much. I'll copy dry your tongue. Dr. Arnaud, thank you for your time. That is going to do it for this Plus Talk. What did you think? Leave a comment below. Let us know. We'll check it out. And if you want to like, follow, and share, you can, because we're across all your favorite social platforms at Plus Life Media. The website is pluslifemedia.com. And check us out on YouTube, Plus Life Official. Until next time, be nice to one another. Keep in touch with your doctor. We'll see you soon. Bye-bye.